Miss Farah, I'm Miss Sarah. So I'm going to do assessment to you, which called Glasgow Coma scale to assess and calculate your level of consciousness.
The Glasgow Coma scale is used to describe the general level of consciousness in patients with traumatic brain injury and to define broad categories of head injury. The GCS is divided into three categories: base eye response, base motor response, and base verbal response. The score is determined by the sum of the score in each of the three categories with a maximum score of 15 and a minimum score of 3. The lower the score, the lower the patient's conscious state. Maximum score of best eye response is 4 and the minimum score is 1. The maximum score of best motor response is 6 and the minimum score is 1. Meanwhile, the maximum score of best verbal response is 5 and the minimum score is 1. A GCS of 8 or less indicates severe injury. GCS of 9 to 12 indicates moderate injury. A GCS score of 13 to 15 is obtained when the injury is minor or mild. However, GCS of 3 and below indicates deep coma or death, in which there will be no response to pain, no verbalizations, and no eye opening. So before we start the assessment, we must wash our hands. Equipment needed are pen light, pen, and GCS chart. Miss Farah, 23 years old, came to the hospital to do a normal checkup. Situation became strange when the nurse asked her the date of today and she replied blue. The nurse noticed the left-sided weakness when the patient grips the nurse's fingers. The score for best eye response will be 4 since the patient's eye responds spontaneously without external stimulation.
Can you raise your right hand? Okay, what about your left hand? Okay, can you raise your right leg and your left leg? Okay, can you take out your tongue?
The patient obeyed the command, so the score of best motor response will be 6.
What is your full name?
What?
Do you know where you are?
Pupil size is 4 mm and breathe. When the eye's pupil reaction to light is brief, we record it as plus. Best eye response is 4, best motor response is 6, and best verbal response is 4. Total score is 14. Patient is in normal condition. However, the patient has to do further examination such as CT scan, MRI, as the patient might have a mild brain injury. Miss Farah, 23 years old, has been admitted to the ward due to brain injury. She has been hit with a baseball bat. She fainted right after the incident happened and she was rushed to the hospital. The score for best eye response will be 1 since the patient shows no response to verbal and painful stimuli. The patient shows abnormal flexion due to the painful stimuli, which is called decorticate posture, so the score of best motor response will be 3. The score for best verbal response will be 2 since the patient cannot participate in a conversation, responding in incomprehensible speech and producing sounds without meaningful content. When the patient's eye pupil cannot open and there is non-reaction to light, we record it as minus. Best eye response is 1, best motor response is 3, and best verbal response is 2. Total score is 6. Patient is in critical condition. When the patient is in critical condition, the patient will have high blood pressure and cause an increase of intracranial pressure. When this happens, the patient might experience bleeding, blood clots, or hematoma in the brain. In conclusions, the GCS is used to objectively describe the extent of impaired consciousness in all types of acute medical and trauma patients. When we do an assessment of a patient, we can get different results. We will interpret the results and see which level that patient is in. The Glasgow Coma scales and its total score have since been incorporated in numerous clinical guidelines and scoring systems for victims of trauma or critical illness. This activity describes the use of the Glasgow Coma scale and reveals the role of using the scale for the interprofessional team to successfully communicate the patient's conditions. That's all from us. Thank you for watching.